Good evening and a very warm welcome once again to all the doctors, nurses, survivors, caregivers, and all the volunteer of the TYAcan Foundation. The wonderful lady on my side is Dr. Prutha.
And with me, I have Dr. Aziz Khan. A warm welcome to one and all on the second day of our conference. We begin the day with session number 5, which is the debate. I request Dr. Amit Joshi, sir, Professor of Medical Oncology at Tata Memorial Hospital, Mumbai, to conduct the debate.
Thank you, Professor Talkar sir, for giving me this opportunity. And without wasting further time, I'd like to start today's first session. And this is the debate of between the for and against the motion. And the question of this is: a young and cured cancer patient should be given preferential opportunity for the employment, yes or no? So the speaker for this, there are two eminent speaker and learned speaker, and then each one will be followed by one survivor which will speak for or against this motion. And I will like to first invite Dr. B.S. Ankit, who is a consultant medical oncologist at SCG Cancer Center, Jaipur, and his special interests are breast, lung cancer and sarcoma. So he will start his point of view regarding this. Over to Dr. Ankit.
Thank you, sir. So our debate is regarding employment opportunities in young cancer survivor patients. So before starting, let's go to the age groups. In India, we say TYA patients from the age of 15 years to 30 years. In US, it is between 15 to 40, and in UK, it's between 15 to 25. So cancer incidences are rising in the older age group, but as we can see, almost 4 to 5% of cancer burden is in TYAs. If we see the data of SEER, and in India, it's even higher. 6 to 7% of the cancers in India are in AYA patients, and which accounts for 80,000 of new cases per year. And according to SEER data, we have 85% survival rate also in TYAs. So if we go with the individual graph, we can see cumulatively there are around 80% of the survival in US, and in the UK data collected in the 2021 statistics, the survival of the AYAs increased from 70 to 80%, and now it is more than 80% for at least 5 years, or it is reaching 82% at 10 years. Similarly, the data is for pediatric patients also, which stating survival of more than 80% for 5 years. So if we see the impact of cancer treatment in the patients, in the cancer survivor patient, there can be a fatigue, neuropathic pain, metabolic syndromes, there can be sexual dysfunction, there can be functional disability, there can be body image disturbances, risk of recurrences, second malignancy chances, mental health issues. So if we specifically see the data of disability among all the disability patients, there are only 5% patients with the disability are cancer survivors. Majority are traumas, communicable diseases, mental health issues, and other non-communicable somatic diseases. If we see at the major burden of the morbidity in AYA also, the cancer survival is the burden is less than 5%. Majority being injuries, mental health issues, substance use, and STDs and malnutritions. So if we see the morbidity and disability, so cancer patients, the general perspective is the cancer patients are having more disability, which is not true. The disability of other causes other than the cancers are even higher. So after the treatment, when the cancer survivorship starts, what the patient need a physical well-being, psychological well-being, social well-being, and a spiritual well-being. And financial and employment comes under the social well-being, but it plays an important role, since if there is an employment and the financial issues are resolved, slowly the family stress goes down, the role of the survivor comes up, so sense of control starts, anxiety and depression weans off, and patients have a better quality of life. better and also the better adherence to the treatment, so a better oncological survival. So employment is an important aspect for the cancer survivors. Employment gives psychological and financial benefits, and there are multiple studies showing that job loss and financial toxicity can have a worse outcome in terms of quality of life, psychological as well as oncological outcomes. So this is the meta-analysis of 231,000 patients done by Scott et al. In 2016, which showed bankrupt or financial toxicity gives almost double the chances of mortality and morbidity in cancer survivor patients. So cancer survivorship and employment, we have to look from various perspectives. So there is a perspective of cancer survivor and caregivers, like financial problems and the quality of life, of the workability, how a patient will be able to work. As individual cancer survivor has a lot of anxiety about the job hours, the flexibility, as well as employment discrimination. Coming to the employers or co-workers perspective, giving the working conditions depends on the co-workers as well as the workload and the working arrangement. There is a major anxiety among employers that how we can provide these issues and how we can resolve. Then there is a healthcare provider perspective. If we increase rehabilitation needs and more program and interventions to include and rehabilitate the patient, then there is a increased employment and return to work data are there. And last but not the least, and the most important, the policies made by the government and the society, which plays the most important role. So employment and returning to work, this is a very initial 2010 study done in Spain, which showed if with the help of government employment services, more than 60% of the patients were able to employed in 12 months. And the patient who were already on work after the end of the treatment, around 62% patients were able to resume their work. And this is the data from Europe and the US, which shows around 60% return to work at 12 months after the diagnosis, and almost 90% at 2 years after the diagnosis. Government policies are very important. I'm here giving the example of United States government policies, which are Americans with Disability Act and Family and Medical Leave Act. So Americans with Disability Act works along with the Equal Employment Opportunity Commissions to give equal rights to the cancer patients along with other disability illness. And the Family and Medical Leave Act gives employee unpaid leave from up to the 12 weeks of unpaid leave and over 12 months of abscond due to if the patient is undergoing the treatment or his or her family relative is under the treatment. And other aspect of the cancer survivor is the accommodation in the working environment, like working from home, changing of the schedule, duties, comfortable seating, physical accommodation, as there are many patients with the functional disability. So there is an initiative started from the governments of the Europe, which started giving a financial incentives to the employers and the company to provide a better accommodation, equipments, and support program. So this is a meta-analysis of after 12 years of incentive, government initiated incentive given to the employers with almost 12 studies showed that the financial incentive given to employers and employers were when the employers were included in the return to work programs and have a flexibility to the employees had a most successful policies according to them. And last but not the least, patient-oriented intervention given by healthcare workers is also very important. So this is again a meta-analysis done in 2017 of more than 10,000 patients there were 4 type of interventions: psychoeducational, functional training, medical, and multidisciplinary. So vocational component and physical training during the treatment and after the treatment from the healthcare worker increase the return to work rates with the risk ratio of 1.1. And this is a very recent trial again done in Netherlands, where oncology occupation physician provided counseling on work-related issues and engagement in supervised physical exercise training during the treatment. And the return to work rate was 86%, 83% at 12 months and 86% at 18 months. So with the increased incidence and the better treatment modalities, we are having more survivors. So need of the employment is more. Burden of the morbidity and the disability among cancer patients are not equal or even less than other causes of disability and morbidities. And cancer survivors employment is one of the most important aspect for the cancer survivorship. Better opportunity for the employment translates into better functional, emotional, and oncological outcomes. Loss for survivors for the equal employment opportunities should be there. Better work environment may be by giving incentive to the employers, and patient-oriented interventions given by healthcare workers can be the cause, can be the further. Yes, sir. Thank you, sir. And I would like to invite Bhivesh to tell about the survivor's perspective, what he feels, what he went through. Bhivesh, over to you.
Sir, please stop screen share. Okay, sir. Thank you.
Is he online? Thank you.
So Vivesh is not online yet. Should we take Shalaka Mane?
I think we will take her opinion at the end. Sir, can we proceed with the other speaker, and we'll, meanwhile we will, at the end of the time we can take the.
Yes, sir.
So
Vivesh is not coming, is it?
I'm calling him. He was about to join.
He's now. Let's see.
Yes, sir. Is there?
Yeah, he's logged in. Should be able to come. Try for 1 minute.
Hello, Bhivesh, over to you.
So can you hear me?
Yes. Yes, we can.
Yes.
Okay. Okay, sir. So my name is Bhivesh, and I'm from Jaipur. And I was diagnosed with non-seminoma germ cell tumor 1 year back, and Dr. Ankit treated me with chemotherapy. And after that, my treatment was over in month of January. And after that, as we got this topic that as a survivor, what things affects us after the survivorship. So in field of employment. So as per my perspective, I guess if you are a cancer survivor, that will that will raise a questions on the stability. If you go for an interview, or if you are being called from a company, so if you tell them your medical history, so they will ask the question about stability. So will you be able to work 9 hours a day or 10 hours a day? If you want any leaves for your regular checkups and all these things, and if you give them all the details, so it might be a little bit possibility that they will say that we are not comfortable to work with you, or you can join later, And I guess this is it because there is a mental, you can say a mental, there is a thinking that the disease you are having that cannot be cured completely. So these are the things which I faced, and I guess in this age, if you are having cancer, if you got the treatment and if you survive, if there is no issue, even after that, you can get these type of situations if you go for an employment or in any company, mostly in corporates. So what we can do, what from my side, I can get a written note from my doctor, so that can work. But there is no such a rule or law or something we can get from a company in which we are already working or in which we are going to join. So there is nothing like that we can get support or someone who can stand for us to get the job, or we can say like who can advocate on our behalf so that we can get a opportunity to grow in a professional career. So these things happens when you go for a proper job. If you have your own business and all, that can work. But if you are going into market in the corporate world, yes, these things raise a questions on stability, or yes, every month you want to leave, or your regular doctor checkups and follow-ups. So if I owe a company and someone like a patient or a survivor comes for an interview or try for a job, even this thing impacts. So I guess these are the problems we are facing, or the people like me or the survivors are facing nowadays. So there is, I can say there is nothing specially designed, or there is no any foundation or something who can stand or provide any advocacy for this.
Bhavesh, for your comment. And I think thank you, Bhavesh, for your comment. And I think I would like to invite Dr. Indu Bansal for against this motion. And Dr. Indu Bansal is a director of radiation oncology and at the Narayana Super Specialty Hospital, Gurgaon. And her special area of interest includes CNS tumor, breast cancer, head and neck, pediatric, and prostate cancer. And she will speak against this notion that the cancer patients should be given. So, please take over. And
I think Siddharth, good afternoon, sir. Thanks for inviting me, but Siddharth wants to speak before me. So I'll speak after him, sir.
Yeah, no issues. Is he on the line?
Yes, sir. Siddharth has joined already.
Is he logged in?
Yes.
Hello, everyone. My name is Siddharth Dasgupta. This was in 2011. My situation is slightly different because I was diagnosed with a benign tumor, but the challenges associated with it were as difficult and as challenging as anything, and the treatment taken for it was as long as and a challenging journey, a challenging process. Thankfully, I was blessed to have a wonderful team take care of me and bring me back to health. Foremost among them, of course, Dr. Indu Bansal, radiotherapist, but also my therapist, and of course, Dr. Mehta at Paris Hospital, who was the surgeon, and I really consider them to be angels sent down to earth. I was muted there for a while. Anyway, am I audible again?
Yes.
Yes, sir. Yes.
I just want to put forward the fact that once uh, you've been through such a challenging time and you've come out of it, touchwood, hopefully strong, healthy, and back into society, the you want to feel that you're very much part of society. You want to feel that you're very much part of life, part of the everyday's flow of life, and that in that regard, you don't really expect or need to have any special, uh, you know, considerations or any sort of token, quota sort of put for you, because I feel that is defeating the purpose that. Uh, and it's also negating the kind of strength you've got from your recovery and from your rejuvenation and your process back to health, because once you've been through all of that, what you really want to do is get back to life and get back to life in the way everyone else is, without expecting any special treatment really. And I think that boosts your confidence, that boosts your mental acumen, but also your physical presence in the world. And I feel that's crucial for someone, a survivor who's managed to use strength and healing and rejuvenation in regaining their life. They really want to feel as though they're very much part of life and that they don't require any special treatment from anyone. And in that regard, they just want to use their abilities. They want to use their challenge, their god-given gifts, and get back to life. With me, for instance, I've managed to get back to my primary love, which is writing. I know of others who've managed to get back to uh, corporate careers as well as careers in the creative industry. Uh, so it very much is possible. Of course, I do realize the fact that it has to be taken on a case-to-case basis, because some patients have to go through a very, very long process. And for them, perhaps it might be viable. But with regards to a majority of survivors, I feel there's a huge sort of strength and empowerment and uh, really a sort of badge of citizenship if we are allowed to get back to life just the way everyone else is, on our own terms, without expecting any special treatment and knowing that we belong. Thank you very much.
Thanks, Siddharth, for your words. And I think, and now I will invite Dr. Indu to talk on this issue.
Good evening, everyone. Thank you, Dr. Amit sir, for having me here. I have two disclaimers to make and one comment. My first disclaimer is that I am not against giving a preferential treatment to cancer patients. So whatever I'm going to speak in my debate will be my viewpoints to strengthen them back to life. And number two, somehow I'm very much against the word survivor, because I feel if we are using the word survivor, in a way, as an oncologist, I'm sending a message to the world कि कैंसर के पेशेंट्स अगर सर्वाइव कर जाते हैं तो ये बहुत बड़ी बात है. So somehow I don't like this word. This is my own comment, and others may not agree to it. And number three that I want to say is that these are my words for Siddharth. I just want you to know that he's raised a very, very important point, that these patients, I strongly believe cancer patients, they don't need any sympathy. They need empathy, and we have to do all efforts to bring them back to the normal life. And there should not be any stigma like cancer added to their names. So these are my three things that I want to say. And something I want to say about Siddharth is that he is a person par excellence. He is a writer of poetry and fiction, and he has 4 to 5 books and which are worth reading. And I read them again and again, again and again, again and again. His fourth book, Movable East, has arrived in March 21 via independent publisher Red River, and his literature appears in literary journals around the world. He writes on the arts and culture for a smattering of global publications. So Siddharth is a living example of what patients can do irrespective of any label of cancer. with these words, I would like to first salute Siddharth and every other cancer winner who is here. And now I would like to go on to my talk. And I think, Doctor, can I share my screen, please?
Yes, ma'am, please.
Yeah. Thank you. So first of all, I would like to thank Dr. Ankit for raising very important points, and I think I'm going to build further on them. So the topic for me is, can you see my full screen? Yeah. So the topic is a patient cured with cancer should get preference in job. And I'm not speaking against the motion, but I'm raising some other pertinent issues because I don't want any of my patient to be shunned away from job. I don't want them to be told that you don't belong to this place. What I want for every patient with cancer is this, that this place is only for you. And this is what we want. We want you to work for us. That is what I want for my cancer patients. So now that there are changing dynamics of cancer patients, not just because of early diagnosis, but because of better treatment, survival rates have improved. And there's a lot of cost shifting environment where the cost of treatment is going up. Cost of survivorship is also going up. And cancer as a disease not just results in clinical burden, but also results in significant productivity loss, and which may ultimately lead to economic burden to the society. And how that happens, I'm just going to show that. So I'm highlighting some facts that population of cancer survivor now exceeds more than 15 million, which is a very good thing to remember. Also, approximately 50% of them are working age, and the employment rates from adult patients has gone up from 12 to 19%. It means more and more likelihood of a cancer diagnosis while being employed and while being working. And this spectrum of employment could vary from full-time, part-time, contract, salaried or hourly workers, or self-employed, as Siddharth also said. Now, there are a lot of issues for employees, which we must not forget. Employers may spend 1/3 or more of a worker's annual salary to hire a replacement when a worker leaves. And these costs include reduced productivity during the time with an unfilled role, the cost of hiring, training new employees, time to peak productivity for a new employee, and possible loss of engagement from others due to high turnover, some business error rates due to not being available on time at the work, and negative workplace culture. So please remember that cancer is a chronic multi-longitudinal condition rather than an episodic incident. So we have to take care of the patients lifelong. So in a study, it was shown that cancer patients return to paid employment after 18 months of diagnosis. 82% return to work. We have to make it 100%. 25% work during their treatment. 20% were not able to return to work, which is a very sad scenario. And 1/3 workers, they reported chronic job-associated stress. There are a long-term consequences of cancer treatment. It's not just the diagnosis, it's not just the treatment, but the post-treatment effects. There are a lot of chemotherapy after effects like short-term memory, executive functioning, speed of processing information. Radiotherapy may lead to some side effects like dryness of mouth, so which may lead to a loss of function for a singer. There could be some rectal bleeding, urinary bleeding. There could be some cardiac or pulmonary toxicity. Similarly, after surgery, person may lose their voice box, so they may not be able to work. There could be breast amputation, which can lead to loss in cosmesis and loss of confidence, loss of limb, and some patients may have colostomy bag or tracheostomy care, which has to be taken care of during treatment. And there are a lot of other effects, and financial drain is definitely a big issue, and fatigue is another very important issue. Unfortunately, cancer is a hungry, money-seeking disease. It sucks away at your financial health. So all the more important for a cancer patient to work during treatment. And it also depends on what type of a cancer you are diagnosed with. So breast cancer patients, prostate, testicular, there are more chances of these people returning to work versus other cancers. There are a lot of personal factors which also affect whether a person will get back to work. And there are workplace factors which cannot be ignored, like how is your supervisor, what are your co-worker relations, availability of work adjustment and accommodation, and perceived workplace support. So these are the issues of a cancer survivor. They have to be handled very gently, very carefully, very fondly, they have to be really nurtured, because they have all these issues of mental stress, fatigue and lack of strength, loss of a physical part which hampers job, need to take time off for appointments. They need flexible working hours. They may have some cognitive dysfunction, financial stress we are talking about, and there are some issues which they work at the workplace, face at the workplace, like assumption that person will be less productive, being left out of decision-making opportunities, being demoted, overlooked, or not promoted for new positions, coping with co-workers, and lack of awareness of rights and responsibilities. So if we just create jobs but don't look into these parameters, I think just providing jobs are not going to help. We need to create a conducive environment for survivors. So there are issues faced by workers at workplace. There might be an actual disability, a perceived history of disability, a misperception of current disability, or uncertainty of daily availability due to unexpected health reasons and risk of disease recurrence. So let's understand some terminology. Disability is physical or mental impairment that substantially limits a major life activity. We know what is a major life activity, and there are certain terms which we need to look at from the perspective of an employer. So there could be absenteeism, means you are percentage of work time missed. Presentism means you are present but you are not able to give your full potential. There could be work ability issue, means how able is a worker to do his or her job with respect to work demands, health and mental resources. And there could be some issues with productivity and gig economy. So what are the issues for an employer? Employer also faces all those issues which a worker faced. In addition to that, there is always this issue of medical legal issues, and co-workers may also accompany the patient. So there could be some loss of productivity from that point of view. An employer has to change the work roles. There are replacement worker cost. Employer also has to get the work done on deadlines, so they may get some revenue loss. They have to bear direct and indirect cost of treatment as medical reimbursement. There are costs of good and overheads. So, and the attitude, behavior, and motivation of the worker towards work has also to be looked into. So, we cannot ignore caregiver expenses, because they also, according to Price et al., 50% of cancer patients with cancer discuss issues with manager, but less than 50% receive work adjustment or support, both for working during treatment or after treatment. So these are the different issues or different problems which a cancer patient faces. So as I said, there are a lot of productivity lost issues because of employment disability, days in bed, being unable to work due to health-related missed work issues, spend a day in bed. So we have to take into account and understand that just providing a job is not going to help. So we have to work in all the three levels. We have to work at the worker level, means the cancer patient has to work on himself. They should not be affected by how people perceive you as a worker, but they have to be confident and give more than their 100%. Before seeking a new position or changing fields, they have to work on these ideas. What are they passionate about? How they can make a difference for an employer? What are their core strengths? What skills and interests do they have? Do they have adequate training? Would they be able to take a lower level position because of non-availability at workplace? And they have the stamina to work at work? So some tips: be honest with yourself about what you can commit to in a job, learn new or marketable skills, create a job search plan that is flexible, focus on doing something you really want to do, and ideally with people you want to work with. Set new or realistic goals, create meaningful relationships, and work on networking. Consider all kinds of flexible situations and think about which might work for you. And please keep your health information private during job search. Don't put your health conditions on Facebook or LinkedIn if you actually want to look for jobs later on. What are the responsibilities of an oncologist? I think all of us have to work together so that a cancer patient return to work in a proper way. We should focus more on developing new oral targeted therapies. Chemotherapy administration in a home setting can be encouraged. We can provide more infusion clinics, shorter radiation treatments which are less toxic and equally effective. We should do more and more organ and function preserving surgeries. There should be more robust recurrence and survival estimates. We should focus on physical, speech, and occupational rehabilitation And there should be occupational physicians to facilitate early return of work, and more treatment innovations which are targeting on quality of life issues. And as a doctor, not just focus on cancer prevention, but also we should do educational programs in corporates about needs of a cancer patient. So what are the responsibilities of an employer? They cannot be just like this, that I'm an employer, I'll do whatever I want to do. They have to be gentle towards the cancer patients. They have to ensure co-worker support, provide flexible working hours, provide better social climate, allow phased return, regular assess the performance and give timely promotions and salary raise, understand the long-lasting side effects of treatment, prevent early exit, provide co-payment models, no deductions in pay or salary discrimination, and conducive environment for work as some resting place during during time to take medications or work release for treatment. Until and unless we provide these, we will not be successful in giving a high quality of life to these patients. There should be certain things which should be expected from the government. Remove stigma of cancer from society. There should be some acts like Americans with Disability Act or Family Medical Leave Act in India also. There should be legal protection and better insurance policies. We should develop a new branch of occupational physicians which can help facilitate early return of these people. There should be vocational and counseling services. There should be more jobs created specifically for cancer patients and provide right kind of solutions and support mechanisms. Laws to preserve dignity and right of a cancer patient, and strict punishment for people who violate them. No discrimination in salary or otherwise at workplace for cancer patients. So if we focus on all these parameters as well, then my cancer patients will reach the top and be the bosses of not just their own work, but in the workplace that they work. So my dream is these patients should not be left alone. We have to work together towards common goal of bringing cancer patients back to mainstream, impart transparent information and data-driven benefit design so that it's a win-win strategy for all stakeholders. That is what I have to say. So I am in hand with Dr. Ankit in providing better opportunities, but it has to be a common goal. I rest my case. Thank you so much.
Now I invite Dr. Ankit for a few words of rebuttal if he wants to say something against that. It will be a quick 2 or 3 minutes.
Sir, we have discussed regarding with Indu ma'am, with sir also said we won't be doing rebuttal on this because there is we were both were saying for the motion.
So I think so I think there is nothing much to for or against. So I think with this I will like to invite at the end Salaka Mane, who is one of the survivor and who works with us in TMH, for her perspective, being in this field for a long time. She's a patient navigator and we know each other very well. So and she has seen generations of patients. So I think let's take her perspective on that. Saraka, please join us.
Thank you, sir. Thank you for introducing me. And yes, my name is Shalaka, and I too am a cancer survivor. But rather, just as Indumam said, I don't like to use this term survivor. I call myself as a victor, and I've encountered this battle with cancer twice in my life. Once when I was a child, and second time when I was a young adolescent. So it was a bitter journey for me, but I take it positively, and I think that my battle has taught me many things, and it has made me stronger than before. So I'm happy to be a part of this healthy conversation and debate. Rather, to sum up this. I would only say that, I have seen a storm just now, and I witnessed to it. And both of the arguments were up to the mark, and they have very well proved and justified their points. Whereas summing up this is as Siddharth said that what we need is to educate, or need someone to educate on behalf of the survivors. But rather, I feel that what we need to do is to create more awareness, because the with is never going to end. And for that, it is not only related to a particular group of people, but whereas we say educated or non-educated people, but it is with everyone in the society, that cancer is treated as an evil till today. And survivors are denied from many of their rights, which they actually deserve. So the reason this topic has come up, the reason behind that is the root cause is the social issue, and also people thinking towards this particular disease. So what I would say is both of you have done your job very well, and there was a healthy discussion. And I would only say to both the parties is to do your job. You keep helping people, but they don't see how much you do for them, but they will notice things when you don't do for them. So you both are doing excellent job. Indu ma'am, Dr. Indu, Dr. Ankit, Vivesh, and Siddharth, very proud of you. And I'm really happy to be a part of this healthy and very nice debate. Thank you, Dr. Chitalkar, for giving me this opportunity. Thank you so much. We can put this on poll.
Yeah.
Dr. Amit.
Yes.
Amit,
Like I think there is an audience poll regarding
can I give
this.
you one suggestion?
Yes, sir.
Clearly state what is for, what is this motion, and so that the audience votes either for or against. I think Amit, you can do that.
Yeah. So the question is: a young and cured of a cancer patient should be given preferential opportunity for employment. That is they should given preference in the employment. So the one question is I support the motion and I do not support the motion. You have two options for this.
Fair enough.
I request everyone to vote so that we can have some
debate, clarity, I guess.
Yes, some clarity or some at least what the people feels about this. What are their thoughts on that? So
you may invite one or two audience questions.
Yeah, so I think while this voting is going on, I will like any of the delegate to have its own words, and there are senior consultants are there. I see the Dr. Malhotra and their perspective on this. If anyone wants to comment in between for a quick, I think that will be really helpful for all of us. Their perspective on this. Is Dr. Malhotra there, sir? Hemant Malhotra, sir?
Yes.
Or Dr. Kurkure, madam, their perspective on this issue, I think it's very crucial because they have seen the generation, various ups and downs in this journey of the adolescent and young patients. Yes, ma'am.
My take on the matter is that you have to first empower there are two sides of the coin. One is when you say preferential treatment and given an opportunity is good. That part is good, but it should not be used. The survivorship should not be used as a entry point or an entry like a pass or a status to be encashed against your all the survivors should be empowered through proper education. That is the first thing. And they should be taken up on their merits or meritorious performance. That is second thing. And the employer should not think that because somebody is a survivor, it should be held against them. That is the most important. What is the hindrance is not the preferential treatment, but the fact that people are taking survivorship or a cancer survivor as a negative aspect. That negativity should not be there, that if you take a cancer survivor, it will be a liability. That part should not be there. That is my thing. Rest of the thing should be with the survivor's performance and merits. So there we should not compromise, because after all, employers have to get their work. They are employing people for certain work, and that work has to be done properly. So if somebody, a cancer survivor, is meritorious for that work, he should be taken it. That time when they should not think that, oh, that person is a cancer survivor and may not do the job properly. That is not there. At the same time, just because somebody is a survivor should not be taken in for the job, even if he or she is a substandard in the performance. No, that should not be the things, because we are saying that cancer survivors are victors and they have overcome the difficulties and they are in the mainstream of the society. They should be in mainstream of the society. They should also compete for all the positions and all the opportunities.
I think Madam has said very important words. I will just read the results. So I think the majority of them will, the around 77% of the audience are in support of the nation, that they need some sort of so I will say that it's not a preference to some sort of encouragement, and around 23% says they are against the motion. So there are two words which Madam has said, which I think I fully agree with that. First, provide them empowerment, and then give them the then judge as a normal person. They will not they do not need any preference if you empower them. And my personal experience is that if you employ them, if you train them properly, they will work better. The overall sincerity, whatever we have seen, that those who have a zeal, those who have won the battle, they are more hardworking. What I have realized. So I think the first point which Madam has said, that give them empowerment and then take a decision as per their ability. So although this the result of this debate shows that majority of them should voted for that favor, but that favor is not the favor in terms of the employment. The favor should be what Madam said, that give them opportunity, teach them, give them the training, and then judge as a normal person. And I'm sure that all the survivors, they do not need this type of favorism. If they are able to do their job, employ them, and then judge. So don't judge before that. So I think it's a question of the giving them the opportunity to learn, to understand, to get them acquainted, and then judge them. So I think with this, I will like to end this session. It was and I will like to thank my both the panelists for this, Dr. Ankit and Dr. Indu, and both of the and Salaka, and both the survivors giving their perspective. And at the end, I would like to thank Dr. Prakash also for bringing this an important topic in the discussion, day-to-day discussion. Thank you, sir. And I will hand over mic to you.
You're welcome.
Thank you, Dr. Amit Joshi, sir.